Kidney myth busting. As a kidney doctor, I get asked these kidney questions day in, day out. First, all patients that are admitted with kidney injury have to be on IV fluids. Absolutely not. IV fluids should only be given if you think that dehydration or low blood volume is causing a kidney injury. IV fluids should never be given just because there's acute kidney injury. In fact, kidney injury can be worsened by giving IV fluids, especially if the kidney injury has been caused by kidney congestion, which happens when the patient has too much fluid in the body. A patient with an acute kidney injury cannot receive diuretics. As I just mentioned, some kidney injury are caused by an excess of fluid in the body. When a patient is fluid overloaded, excess fluid resulting in excess pressure downstream from the kidneys can result in slower blood flow going through the kidneys. This results in reduced filtration of the blood by the kidneys and results in kidney injuries. In this case, diuretics should be given to offload the kidneys and improve kidney injury. All patients with high potassium should immediately get IV fluids. I have seen many juniors do this, almost as a knee-jerk reaction to a high potassium. And F1 told me it's because he wants to dilute the blood. I can see where this theory might be appealing, but in reality, I think it's a wasted step. You're better off using that IV access to, say, give insulin dextrose to reduce potassium levels. Giving IV fluids in this context has no place in my practice and I do not recommend it. Also, 0.9% sodium chloride is often given in this context due to the lack of potassium in the solution. But higher volumes of sodium chloride actually causes metabolic acidosis, which makes the potassium worse. Patient with an acute kidney injury cannot receive contrast for scans. If you ask a group of kidney doctors whether contrast-induced kidney injury exists, some will say it doesn't. Although many will agree that kidney injury caused by contrast does not exist, this cannot be fully disproven due to the lack of good quality studies. My advice is to think whether there is a real clinical need to give contrast for the scan. If there is a real diagnostic need, then give the contrast. There is no point in the patient having functioning kidneys if they are then going to die of a deep-seated infection or an undiagnosed cancer. If you have any other common kidney myths or questions, please write them down in the comment section below. Please like and share this video and follow for more content. I hope that helps.